This is Dr. Greg Hall once again with Better Black Health, and today we're going to do something we haven't done before. Well, actually, we did it once before. I had someone else interview me about the National Institute for African American Health, but now I'm going to have a very special person interview me about the Better Black Health book. And so, as of this point going forward, this is not my podcast, although it really still is my podcast. But I'm going to be interviewed about the Better Black Health book, none other than one of my favorite cousin nieces, Julia Marshall, across the world in California.
Yes.
Julia, welcome to Better Black
Yes.
Health.
Thank you. Thank you for having me. I'm so excited. And yes, as you mentioned, I am one of your cousins from my mother's side. And I'm so happy to be here. Actually, before this podcast, I confirmed, I was like, okay, so how do we line up in family? And she was saying that my great grandmother is one of your father's siblings. So
Yes, right. Your
yes. And I
great
was like,
grandmother was my father's sister. Yeah. That goes
yes.
all the way back there. And your grandfather was my first cousin.
Yes. And so this is very exciting to me because it's like our family, like it's really, this topic is incredibly important. And I feel very honored and grateful to be here and a part of this. And so, yeah, thank you for having me.
Well, and
Uh,
I also want to throw in that your grandfather, my first cousin, was a physician. He was an esteemed
yes.
pediatrician. So all this doctor stuff goes deep into the Hall family. And so
Yes,
I
it
appreciate
does.
you coming and interviewing me. So let's go
Let's
for
get
it.
into it. Okay. So by now, I've been reading and I've read and I have a ton of questions to start. I mean, one thing that I do want to call out and just thank you is that reading through the book, you made it very accessible to read, like very easy and digestible to just take in all the information. So I feel like your readers are going to be very happy about that because I know out there when it comes to medical terms and things like that, it can be hard to digest. So I do feel like that was awesome. I did want to ask you, when it came to precision medicine, how would you really define it? Because this was actually the first time that I had heard the term precision medicine. So how would you define what it means for
Yeah,
your listeners?
good question. I mean,
Yeah.
precision medicine, and I hadn't heard of it as of maybe 2, 3 years ago. So it's not. Don't be surprised if you haven't
Hmm.
heard of it. But I mean, and just like most anything else, it was initially applied more to Asian Americans, and
Okay.
there's a place at Stanford in California. Looking at the precision medicine as relates to Asian Americans who have the longest life expectancy, et cetera, do the best almost in terms of health needs. So
Hmm.
precision medicine considers your genetics, your
Okay.
environment, and your lifestyle. So the genetics is like, like you and I, we're genetically related for sure. But also
Yes.
us, if we're at the store and we see some black person and some Asian person, you and I are still more genetically similar to that to the black person than we are to the Asian person. I'll spot you that, and if you tested the blood, it would be true. So
Okay.
when I think about when people say, "Oh, racial medicine is wrong," I think of it as an African American family, right? So
Absolutely.
my three sons and I are more genetically related than you and I,
Hmm.
right?
Hmm.
You're more
Yes.
genetically related to your siblings, and so and those things matter. The things that your parents have, you have an increased risk for getting. My father had heart disease, my mother had cancer, so I have an increased risk for those things, and the same
Hmm.
thing for all families. But then there's a broader family. There's also those genetics matter, and we should not ignore them, right? And so it's like
Yes.
race-based medicine is bad if you're oppressing someone, if you're not treating their pain, if you're doing it to disadvantage them. But
Hmm.
race-based, I would advance that race-based medicine can also be good if you do it for good. If you're screening them for what they're increased risk for. And there's no question that we are genetically more similar. So that's the part that most people get uncomfortable about. They want all humans to be humans, and
Yes.
and that's the whole big deal about this book, right? That I have the nerve to say, there are differences, and there's all this research that confirm it, and it's been
Yes.
confirming it for years, right? Not
Yes.
this ain't new. It's all been out there, just nobody read it. So
Nobody read it.
right. So genetic medicine, I mean, precision medicine is the genetics, the lifestyle, which people have always kind of considered. Do you smoke? Are you drinking too much? Are you doing drugs? Are you getting enough sleep? You know, all those lifestyle things that people do. Are you eating too much bacon,
Mm-hmm.
pork? You know, are you that's lifestyle? Are you meditating? Are you in a
Mm-hmm.
stressful environment? That's lifestyle, right? And then
Yes.
the other is you have the genetics, the lifestyle, the environment. You know, where are you, right? And so I grew up in the inner city near where a lot of factories were, and so because I grew up near those factories, I have an increased risk for lung cancer just from growing up in that neighborhood. Or if
Wow.
there's
Yeah.
lead exposure in my home, I live in an old house somewhere that they painted with lead paint, or
Mm-hmm.
if I'm near some dump where a factory is dumping waste into the water that's upstream from my house or my cabin or whatever,
Yeah.
that's
Yes.
environment, right? And so by looking at the environment, the lifestyle, and the genetics, we can be precise about the way we treat patients, we evaluate them, and the advice that we get.
Yes. Oh my gosh. Well said. Well said and well explained.
Thank
Oh my
you.
gosh, that makes complete sense. Thank you. And so with all that being said, it's like why did you feel, I mean, I know why you felt this book was necessary, but why did you feel it was necessary now? Like today's age, like right now. I am yeah, why like
Well,
and in the current landscape of Black
yeah.
health.
Well, yeah. So what I did, because I work in public health right here
Okay,
in the
yes.
state of Ohio, and so in public health, we always talked about going upstream, right? And so, you if you're, you see some child, drowning in a river, you jump
Right.
into the river and save them, and then there's another child, and you jump in and save them, and the old adage was, go upstream and see
Nah.
who's throwing these kids in the river. Fix that rather than
Yes, yes.
keeping individually doing each one. So I initially thought I'll go upstream and I write a book for doctors and nurse practitioners and whatnot on the best treatment for Black people. And so in 2019 I published patient-centered clinical care for African Americans. That was my upstream approach. Teach the doctors, right, how to treat
Yes.
black patients. And the book did well. And I just released the second edition, a precision medicine for African Americans. But unfortunately, it's not in the hands of enough doctors. People still aren't
Mm.
reading about that, and so it didn't have the widespread. I figured if you had a bunch of Black patients, you would buy this book, and a lot of
Yes.
people bought the book, but a whole lot of people haven't. You know what I'm saying? And so this is
Yes,
why I said,
absolutely.
well, I got to go to the population, and I'll have to have people really start having to shepherd their doctors and say, well, what about this? I have a book that said this. It's annoying as a physician to someone and say, well, what about this? But it can be helpful. You know what I mean, right?
Absolutely.
So
Oh, yes,
so
absolutely.
we're arming patients who can say, take the book to your doctor. Mention that if something is abnormal and they want you to get, say you have a thyroid test and it's abnormal and they want you to get some follow up labs. You got the book. Oh, Black people tend to have slightly lower thyroid results. It's not
Yes.
a big deal. I don't need to have my blood drawn again. And then it fully referenced so that, if the doctor wants to say, oh, this guy's crazy, he can actually see the
He can
reference
actually
where we
look.
got the information, and it's over and over. It's not just one isolated study. It's study after study that has shown this. It's just that no one's taking the time to read about it. So now as we get
Absolutely.
disenfranchised, they painted over Black Lives Matter, in
Mm,
Washington.
crazy.
They've gotten away with diversity initiatives. They've reversed affirmative action, and so we have to start really taking ownership of our health, but also engaging with the advances that are out there. And so I see too many Black patients that don't want to be on medicine. I don't want this
Right.
done. I don't want to see a specialist. I don't want chemotherapy. And these are all decisions that are not made from a point of knowledge. If they knew
Absolutely.
what I knew, they would engage in it and they would do it. And so that's what this
Yes.
is about.
And you know what? That makes me think about, so when I got to the section about vitamin D deficiency, this brings back, I just had a physical exam, like I think it was a couple weeks ago, and I was vitamin D deficient.
Mm-hmm.
And I read when I read that 80, I think you said 82% of African Americans have experienced that, my
Right.
mind just, because my doctor kind of just brushed over it, like, throw in some extra vitamin D.
Yeah. But you're in
But,
California. You're in California. Imagine
and
being
I'm
in
in
Cleveland.
California.
Yeah, in
Yes.
Cleveland and Chicago and New York and New Jersey, Black people are all vitamin D deficient. The way we
That
got that
is,
80%, that 4 out of 5, that's national, right?
that
The
is
four out of
insane.
the one
Yes.
out of five that don't have vitamin D deficiency are in California. They're in Florida.
Yeah.
They're in
Mm-hmm.
Texas. They're in New Orleans. They're not in any of these big states, where we are. So it's widespread and it's huge how it affects your health.
Huge. Absolutely, yes. But it's even like one of those, like, bring in the book and, like, this is.
You need to be on replacement. You don't just say, your vitamin D, eat more oranges or something, or get more
Yeah.
sun. I mean, you
Yeah,
need, we need to take a replacement. There's really not much else. We can't get enough sun to replace that,
mm-hmm.
because genetically, the part of us that's African comes from African farmers that were in
Okay.
Africa, and
Mm-hmm.
they were outside. They were farmers, and they were
Mm-hmm.
outside 12 hours a day, because they're at the equator. I mean, they're 12-hour days, 12-hour
Yes.
nights all year round. It doesn't change like it changes, for us. And so if your
Mm-hmm.
profession was to be a farmer, you were outside in the sun, you got all the vitamin D you needed. But then when you were displaced to North America, the
Yes.
vitamin D, and then migrated to cities that have much more clouds and much less sun,
Mm-hmm.
end up dramatically more vitamin D deficient.
Absolutely. And I'm someone who, I work from home. So
Mhm.
my day-to-days are inside. I'm inside most of the day. So you take 2025. Most people are working from home these days too. So, I mean, that's another thing. Yeah.
Yeah, I know
Interesting.
it's a big deal, and people, I already, when I see new patients, I'm telling you, your vitamin D is gonna be low. I guarantee you. And when you start taking vitamin D, give
Mhm.
it to everyone at the kitchen table. It's not that's not my doctor, because everybody Black at home is also vitamin D. Because you all
Mm.
tend to probably do the same thing. So if I draw yours and yours is low, anyone else who does anything like you or hangs around you is also probably low.
Absolutely. Oh, that makes me think about, like, getting this book in my hand and then, yeah, spreading the word, sharing, telling others, telling your family. Yes, I've
That's what we
already
need.
started that. That's what we need. That's what we need in this family. Okay, so I wanted to get into the biggest myths about Black health. So we touched on, like, vitamin D deficiency. We've touched on a couple other things, but I guess, like, if you were to sum up everything to make it a little bit shorter to get to the point, like, what would you feel like the biggest myth around Black health, that persists? Yeah, go ahead.
I think the biggest myth is that we should be treated like white people, and that
Come on now.
however we treat white people, then we want that treatment. And
Yes,
I
wow.
think that, sure, in terms of getting the best care and the most expensive studies and stuff, that might be true, right? But
Mm-hmm.
we should not be treated like white people. And so, and you and I both know that I'm part white, you're part white.
Yeah, yeah.
Newsflash, right? Most
Mm-hmm.
African Americans have African component, and they have a white component because of our slave owner
Yes.
ancestors. Right? It's just as simple as that. And so we're not all African, we're not all white, right? But there are nuanced things that we need, like vitamin D, like salt sensitivity we talk about, and like
Absolutely.
all the things that there's diet needs that we need that are different,
Mm-hmm.
and we can't just go to the vitamin store and get anything that the vitamin store sells and think it's appropriate for us, because you saw about vitamin E. Who knew that increased vitamin E in African American males increased my risk for prostate cancer? I don't want prostate cancer, right?
Right.
400 international units. That's what I had in my cabinet. Like my wife's trying to kill me. But what the vitamin E is in there is exactly the dose that would increase a Black man's risk for that.
That is
Calcium. When they tell
insane.
older white women, take some, you're getting 40, take some calcium, make your bones strong. There are people who believe that increased calcium in Black women increases their risk for hormone negative breast cancer, which is
Oh
a
my
big
goodness.
deal. So
Yes,
while
that's huge.
the doctor's telling all these middle aged women, drink some milk, take some calcium, da 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 da. When in reality, he may be increasing their risk for breast cancer by doing that.
Oh
So
my
it's
goodness.
appropriate, perfectly appropriate recommendation for women of European descent, but not
Yes.
appropriate for people of African descent, particularly if you're lactose intolerant, right? So
Mm-hmm.
lactose can't drink milk. There's people that are lactose intolerant. If you're lactose intolerant, you probably have a way of over absorbing calcium, and so going around that by taking
Right.
the lactase enzyme, I can't say the
Mm-hmm.
brand name, but I'm not going to say it,
Yeah,
getting
yeah.
around
I know what you're
that
talking
is not a good thing, because your body is saying, I have a different way of absorbing calcium, because you have bones and you have strong bones and you've never had milk, but so, and there's tons of people who are lactose intolerant but don't try to get around it. I mean, just
about. Oh.
go to a Chinese food restaurant and try to find some cheese, right? I mean,
Oh wait,
there's
yes.
no dishes. There's no cheese dish in the Chinese restaurant. Why? Because
That
they're
is so
disproportionately lactose intolerant. And do they try to figure a way to force cheese? No,
true.
no,
No.
they don't need cheese. I'm lactose intolerant. I can't.
Yes.
Right. So we
I
can try
mean,
to figure a way around it, right?
yes. It's crazy because I'm like sitting here, my mouth is just like wide open. Like, and I would consider myself very intelligent. Like, I work corporate America. I have a great career, but my jaw has been dropped since like talking to you, this conversation, reading the book. And it just makes me wonder, like, how do I not know this as a 35-year-old woman and
Mhm.
my own community and friends? I didn't
Yeah, it's
even put
crazy.
two and two together. It's
It's
crazy.
almost
It's
like
just
it's a
crazy.
conspiracy, but it's not a
Yes.
conspiracy.
It
But
feels like it.
it sure seems like it's
It
conspiracy,
feels
doesn't it? Doesn't it feel like
absolutely
it?
yes.
We don't know who to blame, so it may not be. But that's the thing. I mean, so you don't want to be treated, long answer to long long story short, too late, right? But
Right.
you don't want to be treated the same as a white person. You want the best treatment for an African American, and that's going to mean you need to take a vitamin D supplement, and it's going to mean you need to put less salt in your diet,
Yeah.
than the white person sitting right next to you, right? Just
Absolutely.
because they can
Yes.
eat it, and if they can eat it, it doesn't mean you should find a way to eat it. You know what I'm
Right.
saying,
Yes. Cut it out.
right?
Yes.
I mean,
Yes.
are Chinese
Absolutely.
people, Asian Americans, really trying to put cheese on their fried rice, or
No.
what I mean? No,
No.
has anyone ever even tried that? No,
Never.
because they're not interested in doing that, because they're leaning into their genetics, and they're leaning into their history. They're leaning
Interesting.
into what their body can tolerate. And so if your
Interesting.
body can't
Yes.
tolerate something, you really should listen to it, right?
Absolutely. Yes. And cut it out. Oh my gosh, yes, that's very. I was
Right.
learning so much. It's like from, and so I guess this like brings me into my next question. Now that I have this information, now that I am like digesting this and like really turning like my eye to my health,
Hmm.
like what would you want for my generation? What would you want for me, like in order to get the message out or to give the message to their community, family, like, are the young people, like, what would you be your
Right.
hopes there? Yeah.
Well, that's the thing. We're trying to figure out a way to let people know that we're not inferior. We're actually the same.
Right.
I mean, we've got a great broad gene history.
Absolutely.
No one disagrees that humankind began in Africa. You know what I'm saying?
Mhm.
And that
Yes.
the genome that are the genes that we come from, everyone else was an offshoot of, right? And so there's nothing to be ashamed of. Even things like sickle cell anemia, things that we would see as diseases, even in our family, the gene that causes premature hypertension and kidney failure.
Mm-hmm.
That gene was an approach to a disease that was wiping out millions of people. And so
Right.
that genetic adjustment is the reason why we're here, because of that,
Yes.
right? And so
Mm-hmm.
when people sort of understand that there's these differences, and that we are strong, and we come from strong genes, and we come from an extremely strong people, but we need a nuanced approach to our health, right?
Yes, absolutely.
And we've got to stop waiting for someone else to to give us that. What's going to happen. Some white doctor is going to look at this and say, "That's just full of it. That's terrible." And then unfortunately, there'll be some black doctor who's trying to be chairman of the department that'll also come in and say,
Mm-hmm.
that's true, because he doesn't want it to be true.
Right.
That's a whole nother podcast. You know what I'm saying?
Yeah, yes.
But it's important to know that whatever you read in the book, you should look at the reference. You should Google it. Let AI, AI to this
Oh my
point
gosh.
has not been racist. You know what I'm saying? And so when I
Right.
stick that in, should black men take calcium at their 40s? The AI will say no, they shouldn't. It's like, we're not talking about it. AI knows it, but we're
Hmm.
still not talking about it. Should black men or any men over 40 be taking vitamin E? It increases
It'll tell
everyone's risk
you.
of prostate cancer, but
Oh, wow.
black men have the highest risk for prostate cancer. You know what I mean?
Hmm.
So if you're a white
Yes.
man, you don't really want to take any vitamin E. You know what I mean? Because you don't want
Hmm. Yes,
prostate
yes.
cancer. So if you hear something different, confirm it. Don't just take
Right.
my word for it, and then tell your friend, the people you care about, because there are people avoiding doctors. The book, even talks about how to go to the doctor, how to prepare for it, what questions, what rights do you have. We talk
Yes.
about malpractice, like how, I think I might want to sue. I don't want to be sued, but we still you should have some information on what your rights are in terms of that. So
Absolutely.
I just think it's a really good reference. We've got outstanding reviews on Amazon. People saying it should be in every black family's home. I
It
do believe
should.
that.
I
I do
agree.
believe
I
that.
agree. It
Right.
should be in every black family's home.
Right. And so you and I are really trying to say, how can we get it out there? How can we start a movement so that we can take ownership of our own health
Yes.
and embrace all aspects of health, not alternative stuff, conventional things, everything.
Absolutely. Oh my gosh, that ownership, like the power that comes from like owning who you are, owning your health, it's just amazing. And
It
I
is.
already
It
feel
is.
it. Yeah,
And
it's
we
amazing.
shouldn't depend on someone else to make 100% of the decisions related to our
Correct.
health. I mean,
Hmm.
I think that we've seen the outcomes of that. I mean, you want to find a
Yes.
doctor you trust, and you want them to advise you, but I think it's still worth, kind of checking up and just double checking on that.
Yeah, absolutely. Yeah. Oh, cool. Thank you. All right. So those were my questions for you in regards to just writing the book. And yeah, everything along those lines. I do have my specific topic. So
You have
we
what?
should get into, I have some like diving into the chapters of the book. So I don't know
Okay,
if
all right.
would you like to do that now or do you want to?
Sure, sure. We can dive into some of the chapters. Yeah.
Okay. So the first chapter, and this is the one about mental health. So this is, I would say, my favorite chapter. They're all I love the entire, but the topic that I was particularly drawn to was
Hmm.
chapter 7, the mental and emotional well-being, about
Hmm.
around mental emotional well-being.
Right.
So, and that's especially around like depression, anxiety, and chronic stress. So,
Hmm.
a little bit with my background. So I would consider myself as someone who has been diagnosed with anxiety in the
Hmm.
past. And I am the first person in my family to go to therapy.
Right.
And so being able to read a whole chapter about that, and I also wanted to say, like, I enjoyed and appreciated that it was towards the beginning of the book too, because it is, I mean, they're all important topics, but
Hmm.
having it, come in early was awesome. And just to expand further, I do feel like in the African American community, mental health like has historically been stigmatized,
Yeah.
or even handled privately. Like we're not really talking about it.
Hmm.
Um, and so to just cue this up is like, what did you find in your research around this? Like expanding more. A lot of it's in the book, but why did you feel it was important to bring it up when you did, include in the book? Let's hear it.
Well, it's one of the things that you did, saying, confessing that, you had a problem, with
Yes.
anxiety. And I know the reason the book is dedicated to the patients. It's not dedicated to, my family or anyone in particular. It's dedicated to all my patients, because all of my patients are who really informed me on a one-on-one basis about what their approaches were, particularly when it comes to mental health. And it's particularly a stumbling block, because there's just a lot of people who are incredibly anxious all the
Yes.
time. They're incredibly depressed all the time. And, I think for people who don't know, I mean, if you've ever had times where you just sort of felt antsy or on pins and needles, and it was for absolutely no reason.
No
I mean,
reason.
I've had little episodes of it, and I'm like, why do I feel this way? I don't like how this feels. But people who have a problem with it have that for a prolonged period of time,
Yes.
and it gets old. You know what I mean, right?
Yes.
It gets old.
Absolutely.
So when I see patients about it, their lives, I don't want to say their lives are miserable, but their lives are not as happy, not as content as they could. It's
Well,
aging them. You know what I'm saying? And
absolutely.
I want them to do something about it. And many times they're afraid to talk to their family about it. They're afraid to talk to their spouse,
Mm-hmm.
husband, wife, partner. And they just suffer. And there are all sorts of proven therapies out there. So one of the things I talk about, to my patients, and I don't think I mentioned it in the book, but my father suffered from severe depression.
Mm-hmm.
Depression after my mother passed. He was depressed for years and years before he went on medicine. And then when he went on medicine, then he got all these horrible girlfriends.
Mm-hmm.
A whole different podcast, trust me on that.
Yes.
But one he'd be at my house first thing in the morning. He was going out on dates. He was living. I'm
Mm-hmm.
like, who is this guy? Because I had known to be this person who was just so depressed, and you went around him, you'd almost leave depressed. You know what I mean? And so his
Yes.
life was very unhappy, but it didn't need to be. And I
Right.
tell people that my patients say, I say, this is my father. I'm at increased risk for depression and anxiety.
Me
Here we
too.
are related, Julia, right? You know
Yes.
what I mean?
Yes.
So we
Absolutely.
it runs in our family, so you don't hide from it. It's something that's in our genes to an extent.
Yes.
It is a chemical process. People
Yes.
don't understand that everything we do is a chemical reaction. When I see
Right.
you, if I make noises, if I smell, if I, listen, all of those things ultimately are broken down into chemical reactions. And
Oh
so
wow.
if I feel anxious, it's a chemical reaction. If I feel depressed, it's a chemical reaction. And chemicals can also improve that. So
Yes.
even and relaxation techniques can improve that as well, right? And there are approaches to that. And so all of those things, I use the analogy of a runner's high, right? There are runners that
Yes.
actually run like 6 miles. You get this serotonin release in your brain, and they can draw your
Right.
blood and measure it. And that serotonin makes them happy and feel good. And that's why they're running all that way. They're running for this high that they get that other people get just by having the extra serotonin in their brain. And so the common medicines out there, sertraline and
Mm-hmm.
Prozac, the original stuff. All that stuff did was increase the amount of serotonin that was circulated in a depressed person's brain, just like the
Yes.
runner's high, but without running 6 miles, right? And that increased serotonin made my father feel dramatically better, gave him
Mm.
incredible energy and focus, and it made him chase loose women. Which we weren't
But
thinking
it
about.
worked.
But you gotta take the good with the bad, right?
Yeah, I was gonna say, but it worked. But it worked.
Right, right. But it worked. But
It
so,
worked.
but it can transform people's lives. But
Yes, it
if
can.
in therapy, it's a crazy for people who just think that talking something out helps, but talking something out helps,
It
right?
helps.
Having things stay bottled up and talking, having a different perspective on how you view your life, your
Absolutely.
environment, all that stuff is empowering, right? And knowing that, when people say, I made a point of trying to stay above a lot of things, religion, politics, all
Mhm.
that stuff. But prayer is whatever you make of it. You don't have to be Catholic or Protestant or Muslim or
Right?
Jehovah's Witness or whatever. But if you pray, that's mindfulness, that's thoughtfulness.
Yes.
Your breathing calms, your blood pressure calms, your this demeanor calms, and that's a healthy thing for you. And so that's that. And yoga is a different form of
Yoga.
prayer, meditation,
Yes.
all the things that
Meditation.
cause listening to music without
Yes.
talking and just being immersed in the music is a form of meditation. It's a form of prayer. You know what I'm saying? So, and all of that is
Absolutely.
good for your health, right? And so, but people, what's crazy is people, I keep saying crazy, but people don't know, right? They don't know to take a quiet moment to myself. They don't know to sit
Yes.
and breathe deeply, to go online. You can watch this stuff on YouTube. You know what I mean?
Mm-hmm. Oh,
You can get
yeah.
better.
Absolutely.
They don't know that sleep, not getting proper sleep, having the TV on all night, all that stuff interferes with your mental health and things of that
Mm-hmm.
nature. And so I think when we kind of come together in a discussion like this, there are cultural things that happen in the average Black family
Mm-hmm.
that we can reflect on. I mean, my father didn't want to.
Yes.
He never. I don't know if he ever even admitted he had depression. I don't know if he ever said. And my guess would be he never did say he was depressed. You know what I'm saying?
Right?
He
No. Oh,
probably
I
never
know.
admitted to himself that he was depressed. He said, "Okay, I'll take this medicine," and he got better. And then
Mm-hmm.
when he maybe a year later, he decided he was going to stop taking the medicine, and he went back into
We went
into
back
the
to.
depression.
Yes.
And I was like, Dad, you need to start this medicine back again, and he did it. But I don't think he ever admitted it. But part of that generation, you can't be. We don't have the time to be depressed. We don't have the time
Yeah.
to be anxious. We don't have the time for all this. We have to pull ourselves up by our bootstraps and go to work and do all that stuff.
That right there.
But that's a very dysfunctional approach.
Yes, and that right there, and I gotta say, I mean, it is very vulnerable and revealing to like talk about what you grew up with. Like, I love my family. I love my family, but like I would say I was the first person to actually have that conversation or to be like, hey, just so you guys know, like I'm feeling depressed. I've got anxiety. Like it was so like, what do you mean? You've got so much to be grateful for, right? Like,
Yeah,
look at this big house. Look at all this,
yeah.
and I
But
think that
that's
does
not
stem from.
right, and that's not. Well, that's not the point. I mean, like we look at.
It's not the point.
I think the classic example is Michael Jackson, one of the most miserable
Yeah.
people in the
Yes.
world, and yet he had, from our standpoint, everything.
Everything.
Right? He had
Yes.
everything, money. He had everything he wanted, right? And so
Mm-hmm.
that's how you know that you don't look at, there's I don't have any problems, and that can make you more depressed and more. I don't even have any problems, and you know what I mean. And I'm
Yes.
depressed. So what kind of person am I? You know what I'm saying? But that's not. You
Absolutely.
have to know that that's a thing. Number one,
Mm-hmm.
and it's not. It may not be your. It's not your circumstance that's causing it. Is something else that you might be not aware of that
Oh,
this book might point you in the right direction of.
exactly. Yes. And it's even like caring about that, like as a starting point, like can even like be that catalyst to like, okay, well, whoa, let me look into more of like how I'm feeling. Like I'm feeling like I'm happier because of this, but I'm still feeling ill here. Or it's like the catalyst to that by even acknowledging that, you might
Right,
not
right.
be super
But
happy.
and
So,
right, but no, like if you know that your diet, there's not one thing you can eat that will correct your
that too.
diet, right?
Yes.
There's multiple things. You got to have vegetables and fruit. You got to have
Yes.
fiber. You have to do this. The same thing to correct your mental health. It's not just a pill. You know what I
Mhm.
mean? There may be a pill might help, but it also might be
But
therapy, or it might be exercise, or it might be
sleep.
mindfulness, sleep. Yeah, all those combination of things, or getting away from toxic situations
Oh
and
my gosh,
toxic
yes.
relationships. That can really, I mean, and people you don't think well, they've got money and they've got all this and everybody wants them, but if you don't want them, get away, right? It's
Yes.
like because there are people that will bring you down, and it's
Absolutely.
not it's and they may look like they're on top of the world, but if a toxic relationship will make another person toxic, right? And
Yes. Oh
and
my
now you're
gosh.
doing things that's not even in your personality because of you're in a situation that you shouldn't be in.
Yes. Oh, you got me so hyped right now because because I appreciate you being like so rounded in that topic, like not just when it comes to like medicine, health, but like that fact alone, toxic people, toxic behavior,
Mhm.
positively, and negative thoughts will do. Like that is something that I feel too that I can digest, or people today can digest as well, if that makes sense. Like,
Well, yeah, and it does. And then the thing, like you
because
said,
it's true.
thinking about, I interviewed a guy on neurotoxins and neuroplasticity is what he actually
Oh,
talked about. And he said, and every day he looks in the mirror and says, I'm a good husband. I'm a good doctor. I'm a good father. And I'd never heard
yes,
anything about that. I mean, and then he said, I said, you do that? And he's a neurosurgeon, right? And
hmm,
he is a good husband, a good father, a good, and so, but you listen to what you say to yourself.
yes,
So, I'm so stupid. I'm so fat. I'm so whatever. And you hear that. You're the first person that hears it.
yeah.
And you can internalize those things. And so you should be deliberate. There's a picture in there with a little girl saying, "I'm
And she
special."
has the
Yeah,
yes. Oh,
and that's it's very important for your brain to hear those
yes,
good things. I am special. I am
yes,
unique. There's no one else in the world like me. You know what I mean?
yes.
And
Oh, absolutely.
that's what you have to do. You have to make a point of saying good things to yourself, and
Hmm.
so that you hear yourself, and that can sort of lift you up. And at the same token, there's also, you could have hyperthyroidism. You could have your blood pressure could be too high. There's some stuff that your doctor might diagnose, and oh, that's why I've been. You could be taking too much of some supplement that
Hmm,
somebody
of
told you
course.
was good. You know what I mean? And it's really giving you palpitations or something.
Hmm.
So it's always good to have a primary care doctor you trust, that you kind of run your symptoms by, so they can kind of run some labs and make sure you don't have some metabolic reason for anxiety
Right.
or depression, which most of the time you don't, but you do sometimes, right? And then that would explain everything. But it's
Yes,
important,
absolutely.
like just like we're having this discussion, that people think about all the different perspectives that need to be considered as it relates to your mental health. And
Hmm.
then I just think the transparency of it all within a family,
That too.
it just it does not mean you're the black sheep, which is a terrible thing. I mean, the black sheep of the family, which is that's bad right there,
Isn't
right?
that, yeah, is that crazy
Yeah,
that
right.
that's like a
The white
saying?
sheep bad, right? But
Yeah.
that somehow you're the disappointment in the family because you have anxiety, and someone else could have really bad aneurysm and they're not a disappointment, but the
Right.
person who has this medical problem, anxiety is a disappointment, and that we as a family have got to we've got to move away from how do we deal with that, and we have to learn how to deal with that.
Yes.
How do we best deal with people who have this whole terrible thing with Rob Reiner and his son
Oh
killing
my
him
goodness.
and his
Yes.
mother. I mean, it's just, it's hard for me to get past that. But there's
Hmm.
approaches to dealing with people who have a drug problem, and people who
Hmm.
have schizophrenia, and people who have bipolar disorder. There's best practice in that. And you could have a very nice, well meaning person do the absolute wrong thing to a person with
Yes.
mental illness and trigger something like that.
Yes.
And that's it's I it's terrible. And
It's
it
terrible.
really is terrible. But what's crazy is it's not just Rob Reiner's family. There are other
Correct.
families, black families we never heard of, have the exact same thing. The people who killed their
Yes.
grandfather that raised them, that robbed their grandfather that raised them because of drugs, because of bad friends, because of bad relationships.
Yes.
Bad people do bad things. We just know Rob Reiner's family, right? But there's it's not. It doesn't just happen to super rich Hollywood people. It happens to people and families just like our family, right?
Absolutely. Yes.
So we
Yes.
have to be able to demystify that and be willing to say, how should I? I mean, that's what people go to therapy. If I have a child on that has drug abuse, why do I have to go to therapy? Because you need to figure out how to deal
How
with
to,
them, right?
yes.
You need to learn how to deal with them. You need to learn the best approaches to deal with that. And so there's
Hmm.
nothing
Hmm.
wrong with someone feeling like why I gotta, well, yeah, you need to go there because you have this problem, right?
Yes.
So I
No,
think
it's so
that's one of
true.
the things that we need to kind of demystify, because we black people, we have so many challenges, and we have so many things coming at us that we think we have to put any mental issues on the back burner.
On the back
In
burner.
reality, it needs to be on the front
On the
burner with
front.
knobs. Before we get to the stove, we need to deal with those
Yes.
issues, right?
Absolutely, yes. And to your point, like as well, fast forward to now that I've been through therapy, I've been given the language on how to express myself. I have been able to talk to my family, and in turn, it's actually done wonders when it comes to like my mom, my dad, like everyone. They're caring a little bit more about how they're feeling. Like
Yeah.
it's so, and that did come from the initial like getting the language, taking the steps myself to do it. So
Yeah. That's
to your
wonderful.
point,
That's
yeah,
wonderful.
it's great.
And you have a
Yeah.
great family, so that
And I have a great family as well. Let's just talk about that.
see them doing that. I can
Yes,
see them being very good about that.
they're very receptive. So I will say I feel very, very grateful and blessed for that. Yes. But yeah, I mean, let's see what else. Oh, before we pivot, ashwagandha. Can we touch on that real quick? Ashwagandha.
Yeah. So now
I'm interested.
yeah, your cousin, my son Alex, wrote the chapter on ashwagandha, and
Oh,
I actually didn't know about it. I had some patients on it, but I didn't know whether there was objective evidence. Because what's in the book, I didn't ever want to be anyone's opinion, or I heard somebody, Dr. Sebi, not to talk about him, but it's the people that but that there's objective evidence that this is beneficial. So I looked
okay.
and PubMed and all through the research, and there is benefit from ashwagandha, for some things, but the how much how do you go on ashwagandha versus going on sertraline or going on some other medicine?
That's what I'm curious
It's
about.
hard to know. Cymbalta, there's just a ton of medicines that are out there for depression and anxiety and menstrual irritability and all that stuff is out there. But ashwagandha has good objective evidence. It's safe because it's over the counter, and it's nothing like trying that. But again, just know that whatever the issue is, a pill will help, but it will probably not solve the problem, right? And that's the thing, that you need to take a multi-pronged approach to your mental health, not just one prong. You know what I mean?
Yes,
a pill.
absolutely.
You need being able to talk to a therapist and the value, and that if there's therapists out there that aren't necessarily therapists. There's ministers, there's priests, there's religious leaders. There's you've got some really smart family members that'll be willing to talk to you. You know what I mean? Talk to you
Yes.
and so sometimes that can be an approach. But as long as we're good about giving good advice and we're not being judgmental. You know what I mean?
Yeah.
And that's
huge.
I think I call it front porch advice. And advice you get on the front porch, and it's almost never good. Oh, I wouldn't take no chemotherapy. Ooh, I ain't gonna take any blood pressure medicine. You'll have erection problems. Ooh, I wouldn't have a hip replacement. Somebody had to amputate their leg. That's where all that bad advice comes off the front porch or over the back fence or whatever, right? And so you want to be able to get advice from someone who should be giving advice, right?
Absolutely,
balanced
yes.
advice. Right.
I love hearing. I just keep thinking options. There's so many options, like and so many great options. I really think it just goes back to just knowing that you have options.
Right,
Yeah,
and you can get
people know.
past a lot of that stuff. I mean, there's people with. I did a section on attention deficit. There's people that have attention deficit disorder and dyslexia and this dysphoric syndrome. There's these kids that have this, just really just angry at the world type of things, and to know that it's not just your child. That it is a thing. That a whole lot of other people have it, and that there's an approach, to treating it. And so that, I really try my best to be everything I saw in the office. And then we thought about what were the top things that kind of happened to African Americans and really see what's the best evidence for that. And what would you expect? You see that cognitive behavioral therapy, it's one of those things that people who can't sleep have insomnia, which is also a very prevalent thing. But you go in their bedroom, they've got the TV on, they got the radio going, they got the lights on. It's hot. You know what I mean?
It's hot, yes.
And so when you look at what's the best situation, I talk about sleep, It needs to
Yeah.
be cool. It needs to be dark. It needs the TV needs to be off. The window shades need to be closed.
Hmm.
If you need a sound machine, you may need some headphones, or you need earplugs or whatever. This is how humans are meant to sleep, right?
Yes.
You can't sleep if somebody's playing disco music or disco rap music outside in the front yard. You can't get a good night's sleep, or if you're worried about someone breaking in or whatever. And so
Hmm.
just knowing that those sort of things are out there, those resources are out there whenever you need it, is really what we were trying to provide.
Absolutely. Well, you've done it. I must say, you have really done it.
Well, thank you.
um, yeah, thank you. I mean, I just appreciate this conversation so much, and I mean, hopefully, I'll be back again because I do have more questions around some of the remedies.
All right,
It,
right.
like
We'll,
some remedy topics. Like, you want to hear them?
yeah, sure.
I like that you touched on things like light therapy. I also like that you touched on the topic of marijuana. I feel like
Hmm.
that is a taboo topic that I would love to dive in
Right, right.
another
Well, we'll
time
talk.
because that one is good.
I love that. Thanks so much
Yeah.
for teeing that up. Well,
Oh,
I
of course.
appreciate I appreciate you joining and
Oh,
guesting
I
for me,
appreciate it.
Julia. You did an outstanding job. I appreciate your
Thank you.
energy, I really, and your transparency and everything. And I look forward to talking again.
Oh my gosh, I can't wait. Thank you so
Oh
much. I
yeah, and the
appreciate you.
books are available on Amazon, Barnes and
Yes.
Noble, Walmart, wherever you get books. You can get them. Wherever you get books, you can get them. People order them from their local bookstore, and that's always a good way to do it, because then if they buy a couple of them, somebody else will buy them. And
Yep.
please recommend them to anyone. It's a great gift. You're always trying to figure out what to get somebody for their birthday, for a holiday, or something. It's a really great, the gift that keeps on giving, right? Good health. I
Yes.
mean, how often do you give a book that someone will continue to open for the rest of their lives? I mean, that's a really cool thing, and so I'm really proud to bring that to you. So thanks again, Julia Marshall.
Thank you. Thank you. Thank you for having me. Appreciate it.